Welcome. My name is Corinne Waldow. I'm the Senior Director for Economic Vitality at the Boulder Chamber. And I want to thank you for joining us today for this special session as we move to level orange, high risk within Boulder County. It started today, and we know you have a lot of questions, therefore, this special session. Jesse will be going over a lot of the basic information you need to know, things we've learned over the last couple of days based on questions that have already come in. But do not hesitate to put your questions in the Q&A or chat, and then I'll ask them on your behalf. At this point, I'm going to hand it over to you, Jesse.
Thanks, Corinne. And I appreciate everyone joining us for another session. I know this is a lot to take in, and hopefully we'll be able to answer your questions. And as I said on Wednesday, if we don't get to your question or if we need to dig in more, I will work with Corinne to get those answers out to you as soon as possible. So as we did on Wednesday, we'll do a quick epidemiological update, try to explain why we are where we are. I do want to talk about sick employees, and then get into the dial status and the public health order updates. So we're moving to high risk. We moved to high risk today, and we will be in high risk for some time. All businesses will need to comply with this high risk guidance. There's been some discussion about critical businesses, and I can talk to that in a little bit, but the important thing is that all businesses need to enforce the social distancing and mask guidance that's in the high risk guidance. And then in addition, you have your capacity limits. So this is our 5-day average number of new cases. And this, same chart from Wednesday. So I don't have a ton of new numbers for the chart, but what I can tell you is that the right-hand side of that graph is continuing to rise. And according to the state, as well as our county health officials, it is likely that there are a number of people who are not reporting that they have coronavirus or not getting tested. And so we are almost certainly undercounting the number of people who have coronavirus at this point. Again, we're seeing that same mix where some of our, in September, Boulder accounted for the vast majority of new cases. Now it's more spread out, although we are seeing larger numbers in Longmont than we have in the past, and that is a worrying trend. Again, just wanted to point out here that we are seeing an increase across all age groups in new cases. So it's hitting all of us. And hospitalizations are continuing to increase. There were, I believe I saw on the daily camera today, there were 2 people who passed away, and all of our hospitals are, either in or heading towards surge mode for dealing with new coronavirus hospitalizations. So we are in a very serious situation. So again, these are the key takeaways. Nothing really new here, but again, because we are seeing this across all age groups, we're again seeing cases in long-term care facilities, which is a dangerous situation. For sick employees, and I took out all the details, but I just wanted to remind everyone, this is really important. If you find out that you have a sick employee, you need to help the sick employee, and then you also need to help your other employees. They are going to find out that someone is sick. If they don't hear it from you, they call us, and it's not helpful for anybody. Trying to track and trace who is sick is really important. It's a lot of what our public health team does, and being able to identify who it is and quarantine people who might be impacted by close contact is the best way we stop this from overwhelming hospitals and leading to more mortality. So really just hammering home, if you have questions about how to manage a single sick employee or a possible outbreak, I'm happy to talk about it. At the end, I didn't want to go into the details of those slides here, but happy to talk about it. So, as I said before, and Corinne said as well, we are at level 3 high risk. They're still keeping the numbers on the dial, which I do not understand, even though they've said they're not using the numbers anymore. We are at high risk or orange. And that is based on these 3 metrics. And remember that to move down the dial, to move into worst categories, we do not have to be bad in all 3 of those categories. If we are in a lower level in any category, the state can move us there. And that's what we saw this week. And so with that, these numbers I updated today, we are at 366.2 cases per 100,000. That actually puts us into red. That puts us into stay at home. So, you know, the fact that we're in level 3 and that we're being given this opportunity to really clamp down on this is a good thing, and I think it's a testament to the fact that our business community has been working really hard to comply. Our current positivity rate is 6.1%. That's the highest it's been in a while. And one of the things I noted, I didn't note, but in this presentation, but I noted on Wednesday was that we are seeing positivity rates increase across all age groups. So while we're seeing great testing numbers, that's excellent. We are seeing this positivity rate increase across all age groups, which means everyone's being impacted. And then finally, hospitalizations. We are still in a good position with hospitalizations in terms of admissions. However, last week we were at, I think, 14 days of decreasing or stable admissions. On Wednesday, we were at 9 days, and now we're at 8 days of decreasing or stable admissions. So it's not headed in the right direction. So jumping to capacities, and I'm sure we'll spend some time here moving forward. You know, the schools, both higher education and P through 12, remember that the school districts manage that. For private schools, we do recommend moving to a remote or hybrid. For the school districts, they are working directly with the state as well as with the public health director to try to identify ways to stay in school. So that effort is continuing. For places of worship, 25% or 50 people, whichever is fewer. For restaurants, 25% or 50 people indoors, and outdoors you need to maintain 6 feet between patrons. And also, and Corinne reminded me to add this today, last call is now 10 p.m. for all alcohol sales. Offices are at 25% of capacity. This is a change that I think it's important to highlight. In the past, we've talked about the fire code capacity. The way that the state is now measuring this in their most recent public health order is not by fire code capacity, but by your office capacity. So however many desks you have in your office, you can go to 25% of that right now. That's it. For critical offices, there is no capacity limit. However, you still have to maintain all of your social distancing and mask wearing. And we can get into the critical business definition later if that would be helpful. For gyms, recreation centers, 25% capacity or 25 people indoors. Outdoors, and this is a change as well, outdoors, if you're associated with the rec center, if you're doing an activity that's associated with a program from the rec center, you can have 25 people. However, if you're just gathering outdoors for a pickup game, for example, your groups need to be less than 10. And in addition, remember that unorganized groups of 10 people, I don't know how else to describe that. If you don't fall under a different category, you're just a group gathering, and group gatherings need to be maximum of 10 people and maximum of 2 households. And that's at every level of the dial. So group sports, outdoors in groups less than 10, they can, if they're associated again with a program, be up to 25. And I think importantly here, and I didn't put this on the slide, indoor sports are not allowed. Indoor practices are allowed, but you cannot play a game indoors for any indoor sport. Retail capacity is 25%, and that is the fire code capacity, 25% of the fire code. Personal services, 25% capacity or 25 people, whichever is fewer, and that's again the fire code capacity. For events, indoor 25% or 50 people with the calculator. So again, for an event that's not seated, you need to be maintaining that 144 square feet around each person. That's what the calculator helps you do. For outdoors events, 25% or 50 people with 6-foot distancing. So that's important. The numbers are the same, but the spacing is different. So indoor capacity limits, excuse me, are 25% of pre-pandemic levels if you can maintain social distancing. This is the really important thing. You can't, if you have a tiny office that you used to fit 8 people in, and you want to say, okay, well, I can fit 2 people in there, but they have to sit right next to each other, even with masks on, that is not appropriate. So it's really important that those capacity limits be based on the fact that you need to maintain social distancing. The calculator can be helpful, but as noted here, it's not required except in the case of events. That is a required use of it. And this was put together by one of my colleagues, and I really agree with this statement. Err on the side of caution. It is incredibly important that we think about maximizing the space between people. So the more seriously you take this, the better for your outcomes, for our outcomes. This is about protecting the whole community. So critical businesses. Appendix A of the public health order lists all of those businesses. It breaks them down by type of business, and they are varied across that. But the important thing here is that critical businesses have to maintain social distancing. Everybody has to wear a mask. All of those things remain true. It's just your capacity limits are not there. You can be at full capacity. So this, has been a slide for the last couple weeks, and I really just want to reiterate. It goes back to that how seriously we take this. If you require mask use, if you socially distance, if you wash hands, if you follow the state guidance, and you limit group gatherings, we have a chance to go back to level 2 or even better. And really, even beyond our community, these behaviors, these practices will help the whole state move out of this, which is really the only way this is going to be solved, because we have so much mobility between communities here, which is a great thing, that it can, an outbreak in one community very quickly spreads to other communities. So the exposure notification system, excuse me, Corinne found a much better link, and so I threw that up on here, and I'm sure she'll share it in her email out to people. It is a free and voluntary service, helps you find if you've been exposed, and there are all sorts of protections for privacy, and it's available on both iOS and Android phones. So just, I really encourage you to use that tool.
Can I point out
yeah.
something on this one?
Yeah.
So it goes off Bluetooth. There's no personal information that's shared. Even if someone tests positive, it's not personal information being shared in that, and it goes off Bluetooth, not GPS.
Yeah.
And we've gotten word that there is some hesitancy to sign up from certain industries because there's this fear that you get an exposure notification and automatically have to quarantine for 14 days. And I think you checked in with the lawyers on that a little bit. And if you could answer that question, because I know we have some of those industries on today's call.
So, if you get a exposure notification, we encourage you to quarantine. But I think the best thing to do is to contact public health, contact your place of work, and figure out your next steps from there. You do not immediately see that on your phone and go, well, okay, everything's over, I got to go inside. It's a tool, information tool. It is not a order. It is not a requirement. The idea is now I have more information. Now I need to contact public health. I need to contact my employer and go from there. That's my best explanation. Corinne, did you have any more to add on that?
No, but I just think that, it's not sharing public information, and it's to your benefit to know if you've been exposed. Because right now, 1 in every 100 people in Colorado currently is has the virus.
Mhm.
So to know if you're exposed, to use the technology that's available, and to then prevent you from spreading it when you didn't even know you potentially had it.
Right.
Stop those outbreaks at businesses so they don't make the Wednesday edition of the Daily Camera. Those types of things. Even if the exposure didn't happen in the office, 2 or more cases within a business. I just wanted to point out that it is a technology that's out there, and personal information isn't shared. And they have a lot of questions answered on that adyourphone.com.
Yeah. I couldn't agree more, the value of this tool, and sort of to get into a little bit of the privacy stuff. It does not, when if and when you were to get a notification that you had been near someone, it wouldn't say you were near Phil and he has they're not identifying who you got it from. They're just saying you were near someone who had this. It's not a time thing, so you do need to do more research, but it's just a great piece of information. And exactly as Corinne said, it's information that helps us stop these outbreaks. So moving on. So this was something that came out, I believe it came out on Thursday. I don't know the exact date.
And I sent it out this morning when
Oh,
I sent
great.
out the notice for this. I particularly put in these words.
Awesome. I think it's really important. This is not an order from the governor. This is a press release, but he is trying to encourage really good behavior, and that is stay home. Interact with only those in your household. Don't go to parties. Don't go to events if you can help it. I know that that's an important part of all of our lives, and I think what the governor is trying to say and what public health officials are trying to say is if we can tamp this down, we have a way forward. Otherwise, we just go to stricter and stricter conditions. And unless we all behave better, we're not going to get better. So that's really, I don't know. It seems like a very preschool lesson for all of us, but I think it's very important that we really focus on our behavior and what it means and reducing those risky situations. So again, and I apologize I didn't update this slide, but Wednesdays normally we have a 3 p.m. general update, and at 4 p.m. we usually have a special session. This past week it was gyms and recreation centers. Next week, if there are still questions, we can probably just keep on with the conversation after the 3 p.m. call. But unless there's some other sector that pops up that we want to dig into the details for. But I really encourage you to listen in on the 3 p.m. calls. And I know Corinne has done an amazing job making these available. You can go back to listen to old ones. And I actually do encourage that, even though some of the guidance has changed, some of the conversations early on about practices still hold true. And that's a good reminder that, again, at level 3, most practices shouldn't change. Social distancing, cleaning surfaces, um, you know, doing appointments such that people can walk right in from their car and go to their massage appointment instead of sitting in a lobby. Those are all practices that should continue at this level. Really, what we're looking at is what is the um, what is the capacity of a space. And finally, if you have questions, comments, please email us at covidbiz@bouldercounty.org. If you have concerns or want to report a violation, you can call the call center. They can certainly also answer questions, but I will say that in most cases, if you call the call center, they're going to ask you to email us, or they're going to give you an answer and then say, but you should speak with COVID Biz, and we can help with that. So it's maybe easier just to get directly in touch with us. And with that, happy to answer questions. And I see that a lot of them have come in.
Yeah, there are a lot of questions. And some people have raised their hands, and I've asked you to actually lower your hands. We have a lot of people on this call. So if you put your questions in the Q&A, that would make it a lot easier. And I'll ask your questions on your behalf. We try to group the questions in by topic so that we can get through a topic and then move on to the next. So I'm actually going to cover a topic that we weren't able to get to on Wednesday first, because I actually have another question that came in from that. And that's, we have some museums and some small, sewing schools and others that do small education programs for children. First off, does this need to follow the personal gathering order of 2 families?
So,
and can they continue these education efforts?
So you can absolutely continue those education efforts as long as, period. That doesn't really help. I think the way to think about it, and I see the question from the sewing school, and we talked earlier about the questions from the museums. The important thing to do is look at the guidance online, covid19.colorado.gov, and see which sector you feel like you would fit into. If you don't fit into a sector, then, or you don't feel like you can meet all of the requirements of that sector, then what you're doing is a group gathering, and that needs to meet group gathering guidance. That's the simplest way of answering the question, but I think to try and dig in a little bit on the museums first, think about each room in a museum as a separate room with a separate occupancy limit. If you can maintain social distancing, if you can keep the space clean, if you can limit the numbers of people involved, you absolutely can continue those programs. But it really is, can you maintain, for museums, think of each one of those as an event. Can you maintain all of the event guidance, or can you maintain all of the education guidance in that space? If not, then you need to move to group gathering. And I would say the same for the sewing school. Again, if you're having people over, you are that's a situation that could be dangerous. And I would actually say that sewing, unless you can keep sewing machines, if you're using sewing machines, but if you're doing by hand, can you keep everyone 10 feet apart? That's the sort of behavior that you really have to get into about how many people can be in a space together.
And using your own personal materials, not
Yes.
crossover materials, you making sure you maintain the distancing, wearing masks. And then also if it's not making sure that you're following all the cleaning standards and so forth.
Absolutely.
And I think that's the question. I've gotten a lot of capacity questions. I've answered so many capacity questions over the last 2 days. I think I was dreaming about capacity last night, but I think the change to orange does make some changes to capacity. But what we're hearing is that people are still forgetting that you got to maintain that social distancing. So you don't want to fit in that extra employee if that extra employee is going to make it so you're not maintaining social distancing. Employee health checks. Jesse, can you talk about whether those need to continue and how important those are?
Yes. Please continue your employee health checks. And for those sectors that need to do them, continue your customer health checks as well. They are incredibly important because that is where you're going to catch the person who doesn't feel sick yet, who might have a high temperature but has a high tolerance for pain or something like that. And it's just like, well, I feel a little fuzzy, but whatever. Those sorts of checks are where you're going to stop an infection from spreading inside your business. So I think continuing them is important, but also, and this is something that Corinne, you and I have talked about, and it's come up in previous conversations. Keeping records is also helpful, because so that you can then see trends in individual employees or in a group of employees' health over time. And I'm not talking about going back and figuring out what their general health is, but if you have an outbreak, you can see who worked at the same time as the person who got sick or the people who got sick. You can see if anybody else checked in at exactly the same time. Did they have coffee breaks at the same time? Those are the sorts of details that are going to help you track a possible outbreak much faster. And that goes back to something that isn't in these slides, but has come up in almost all of our other conversations about this. If you have an outbreak in your business, your first step is to close the business and then contact public health, and we help you try and get the business open again. The more difficult it is to track who is impacted, the less quickly we can get your business open. And that's really important. We want you to be open.
And the definition of an outbreak is 2 cases within 14 days.
Yes.
So you could have an individual case, and a second case within 14 days will trigger an outbreak response.
Right.
So that's why a sick employee means you need to make sure that you're taking all the appropriate actions within that for sick employee guidance, which I've sent out a couple times, but I'll send out again, so that you prevent it from becoming an outbreak and you don't have to close down your business. And what I've told every business that's called me and said, I have a sick employee, I said, get your records in order. Make sure you have your symptom screenings. Make sure you know who works with who. Because just as Jesse said, if you happen to get a second employee that tests positive, to lessen the impact on your business, you need to have your records in order. Now, I put in the chat the employee symptom screening guidance on the major versus minor symptoms. And I put that in the chat, and I'll send it out again. And also a link to a symptom screening form. Reminder that if you keep this form just out there and people put their names on and everybody can see each other's names, that might be in violation of some privacy rules within your HR. So think about how you can keep some of that information private, and you have a singular point of contact or a point of contact per shift that collects that information. We're going back to the May guidance that we were putting out there. So that goes to the symptom screening. So capacities. On restaurants, capacities do not include staff.
Yes.
Correct?
Yes.
Retail and personal services, they include staff, correct?
Yes. Yeah. And for Wednesday, I will definitely add those notes in. I apologize I didn't add them in. I know that it is confusing because each sector now has include staff or doesn't include staff. And so again, I would recommend checking covid19.colorado.gov and actually looking for the latest public health order, which I think Corinne has shared in the past.
I just put it in the chat too.
Oh, awesome. Read in the orange section. Every sector is there. It says what your capacity is, and then it includes a note on whether it includes employees or not.
Okay. All right. So Denver has moved to a kind of a curfew, and I know Pueblo also did this. People need to be home by 10 p.m. Is that something that Boulder County is looking to do as well? And then there's a second part where Denver also reduced the number of people at a restaurant table to 6. Are these some additional actions that may be imparted on Boulder businesses as well?
So we have first of all, I don't make those decisions. And I sometimes get to sit in on meetings where we discuss things like Denver's call or Pueblo's call to do that. But at this time, I know of no plans. The one thing I will say about that is that I do know that there are conversations about it. When Denver brought it up with the metro directors, there was obviously conversation about it. And I think that the general consensus I understood was people were uncomfortable moving there for equity reasons, for impact to business reasons, as well as it doesn't make a lot of sense for example, Erie. What happens if Boulder moves to a 10 p.m. curfew, but Weld doesn't? The same for Longmont. Or Superior, which is right on the border, or Broomfield. What if Broomfield doesn't move? And so, any action needs to be done collectively from our perspective. So if those discussions are occurring, I think they're occurring across the whole region. And again, I shouldn't say this. My understanding again is that our goal is to let you know in as far as far in advance as possible. We were hoping the governor would do the same. Unfortunately, uh, he's not held to the same standard as we are in terms of trying to support our individual businesses. So I don't know of any serious conversations about that.
Okay, so let's move back to that capacity and the exclusion, non-exclusion of employees. So the rationale for restaurants allowing the exclusion of employees and maybe retailers and personal services is because within the retail and personal service space, there might be people moving around at all times, whereas restaurant, once you come in, you sit down, and the employees are then the ones that are moving. Is that sort of, that's what I've heard.
Yeah.
And I know there's a question about why are staff excluded for restaurants but not retail? And it's really about the use of the space and what happens when people enter that space, correct?
Yes. And it's also, I mean, this is going to sound harsh on retail businesses, but restaurants have a level of cleanliness that is required by state law for licensing. And so they're keeping their, their hand washing, their that sort of stuff is at a higher level. And I don't mean, again, to say anything about retail, but it is sort of baked into their operations. And so there's some thought that they're masked, their patrons are not, but they're washing their hands, they're doing all that stuff that helps them reduce the chance of spread. So but I think Corinne, you're spot on that it's really about the movement question.
Okay. To follow up on the, that 10 p.m., curfew, those types of things that currently Boulder County does not have. Denver, Pueblo, some others have these. We have a follow-up question that says, are there any additional mitigation efforts that BCPH is considering? Or was this move to orange kind of our mitigation effort right at this time?
So as far as I know, we are not considering any additional changes. I think that's an ongoing discussion at all times when we try to see what businesses are struggling with, what the community is struggling with, and then try to figure out how to work with the community to address those. So no, I am not aware of any other changes. And I will say that you know the move to orange was direct from the state. At the time that we were moved, we had so last week we had a conversation with the state that we all knew that there was a chance we would move to orange, but we said, okay, we're going to develop a mitigation plan as outlined in the dial framework. We consulted with the state. We started that process. A number of my colleagues were working on that. And then before we could even submit our mitigation plan, they said, oh, you're moving to level orange.
You got the letter from Jill Hunsiger Ryan, the head of CDPHE, that said Boulder County will be moving to level orange.
Right.
So the order that I posted in the chat, those are all state orders, and the state moved Boulder County to this level. I've gotten communications from businesses in town saying Boulder County has made the decision to move to this level, and really it was a state decision, and Boulder County is required to enforce that decision.
Yep.
While we also recognize that we have some disturbing numbers in our community with the number of cases and number of hospitalizations. So we need to recognize both pieces of that, but Boulder County Public Health's role is to enforce the order, and the only additional order that Boulder County Public Health has is the outdoor mask order.
Yes, I was about to say that's exactly what I was going to mention. The one thing is that from the very beginning, we've had an outdoor mask order, not from the very beginning, but from when mask orders started to go into place, we included a mask order for outdoor spaces if you can't maintain 6 feet. And that's still in place, and it has not been echoed by the state yet.
Okay. All right. So let's move through some specific. There are people that are going around to businesses and noticing that some of our stores are not following protocols, not requiring masks, may not be doing some of the protocols. What should we do? what should that person do? What should a person do if there are violations? And I just want to note that I did put the violation form in the chat as well. It's the first thing that I put in there.
Awesome.
But can you talk about violations?
Yeah.
How Boulder County Public Health is dealing with violations, and the what you can do as the public health authority when it comes to violations.
So yeah, I'm happy to. So our method continues to be communication and cooperation first. When we get a complaint, whether it comes to us through email or through the call center, we reach out to that business and say, we received a report of X, Y, and Z. Can we talk about your, how you are maintaining the protocols as they are in place? And we try to listen for what what their process is and identify any issues there. If that fails, if we continue to get complaints, we have a couple options, but our first step is to send an email, or sorry, not an email, a letter saying, here is the public health order. Here is what we talked about in the past. Here are the complaints we're receiving. If you don't change, the county has a number of tools. And those tools are, if again, we see continued non-compliance, we can go to court to pursue fines. If you are in a municipality, we can go to your municipality and ask them to revoke your business license. That can also be done at the state level. So for businesses in the unincorporated county, we can go to the state to say, this business is not complying with the public health orders from the state. We have multiple violations. We've communicated with them. We've done this X, Y, and Z. Here's our evidence. And then they can take that business's license. But again, we do give a lot of leeway to the businesses. We want businesses to continue to operate. We recognize that the variety of businesses that are out there are really helping our community function and feel a little normal. It's nice to have restaurants open. It feels normal. And that is a good thing. Having a little tiny bit of normalcy helps a lot. So that's the basis for our method.
And you work with the business. Like if it's
Oh,
a
yeah.
singular mask question, you're going to work with the business and may find out that that person had an exemption, or there was something that was going on there.
And
in a lot of cases, you haven't done you've done a lot of education, but there's only been one or two notices that have gone out.
Yep.
Where people didn't make changes.
Yep. And that's not two things. One, I would say that's not to say that we haven't carried this up to higher levels for businesses that have multiple locations or businesses that may not be local. We are working with their regional offices to explain that Colorado has rules. You have to follow those rules, and we are not afraid to, the state would be the source for any lawsuits against those larger companies. But we've started conversations with the state about a variety of companies to try to get better compliance. What it usually results in is good conversations with their regional offices to say, oh yeah, no, we will start complying. That is not to say that we get 100% compliance ever. There are always, I see a comment in here about, someone going to a store and seeing someone without a mask on. Happens all the time. And we encourage businesses to approach those people to try and address that. But yes, those people could claim a medical exemption. They can say, I don't want to do that. And it's at that point that it's the business's responsibility to kick that person out if they don't want to do that. You have the right as a business owner or a business manager, if you are practicing this across the board and not targeting particular individuals, you have the right to refuse service. You also have the right to provide alternative service, and that's what we recommend. If someone comes in and says, I don't want to wear a mask, tell them that you can bring stuff to them outside, or they can order online if that's a possibility, or whatever it is that keeps them out of your store. Because again, it's not just that person is breaking the rules. They're making everyone else in the store unsafe and really uncomfortable. I was in the grocery store this week. There were two people without masks on. it was freaky. Like I actually kept looking at them like, how everyone else has masks on. How do these new people? I don't know their story. They may have had a very good reason, but I think it's really important that we reinforce the value of masking and social distancing um,
And it
across
helps
the
your
board.
business because there are a lot of people out there that are worried.
Yeah,
So
absolutely.
seeing your compliance, seeing the efforts you're going through do help with consumer confidence. There's two ends of the spectrum. So that's, there's the other side that if you have a lot of people walking around without masks, you're gonna no longer have the people coming in that, really want people to be wearing masks before they go in. So there are two sides to this. Now, can you go a little bit on the compliance piece? You talked about everybody needs to comply, and there's a question if this includes essential businesses like grocers. Um, and
Yes, yes. You still need to comply. You need to make sure that everyone's wearing masks. Sorry, Corinne, I didn't mean to cut you off.
no, you're
Um,
you're great.
um, everyone needs to be wearing a mask. Everyone needs to social distance. That's one of the things that I think is really important that I see in some in it's really in most stores now at some level or another, and it's really nice is the little stickers on the ground reminding people how to while they're waiting in line to stay 6 feet apart. It's amazing how just a couple stickers people love standing on those stickers. I don't know what it is, but I went in to get coffee on Thursday and I was standing on the sticker and I didn't move forward until the next sticker was available. Maybe I just like following rules. I don't know what it is. But no matter what type of business you are, you have to comply. Um, if you are a critical business that supplies hardware and tools, um, and you are violating the public health order, we will send a letter. We will reach out to you, and if necessary, we will seek to fine or revoke a license. Um, there's no reason to endanger the public.
And critical businesses, their capacities may
Right.
be a little different. There might be some differences there, but they still have to comply with the
Right.
masking orders. They still have to comply with all those pieces that are within the orders.
And I think one thing to note about some of the larger businesses that are critical businesses, they also need to be because they're so big, and this includes grocery stores, trying to maintain an understanding of the number of people in a space is really important. You do not have to meet any capacity limits. However, it's really important that you're aware of how many people are in your space because again, you do need to maintain social distancing. So that
That's a question just came up. Do we need to maintain occupancy limits or the other piece? But even if you're not maintaining critical businesses only, critical
Yep.
businesses, even if you're not, having to maintain occupancy limits, you need to assure there's 6 feet distancing between people. You need to assure there's masking. You need to assure that you're doing employee health checks, whatever's required of your industry within that critical business to meet compliance. Are you there, Jesse? Okay.
Yep. Yep.
Just want to make
Sorry.
sure. All right, so I'm going to get into some of these industries because we have a lot of specific industries. So we'll go into here. Indoor pools. Were you able to give? So if we have an indoor pool, let's talk first about can you have swimming lessons in
Yes.
an indoor pool?
Yes.
Um, and if it's a certain 10 or less kids, maintaining distancing, this include parents.
So the we actually had some really good questions from our municipal rec centers about this, and I don't know if some of them are on the call or not, but I really like they dug into these issues, and I guess I would say the state is treating pools, indoor pools, like a room, so you can have 25 people or 25% capacity, whichever is fewer. If you're doing lessons, uh, one of the suggestions from one of our rec centers I thought was really great, and that is so if you have an instructor, they can't maintain social distancing and interact with your each of their students in the pool. But if they stay on the pool deck and you have parents in the pool with the student and they're socially distanced, then everybody's socially distant and you're just then worried about your 25 people. So you have to have a class that's small enough. You have to have 12 students only, so that with each one having one parent, you're not going over 25.
It's not limited to 2 households because it's a lesson and
Right.
it now falls under a
Absolutely.
different set of guidance.
Absolutely. That's, the most confusing, and I wish it was easier to explain, but basically the state has said if you fall under a specific set of guidance, you follow those numbers. If you don't fall under any specific set of guidance, or you cannot meet all of the requirements of that type of guidance, then you are a group gathering of 10 and you have to be 10 people or
So
two
let's use an
households.
example. How about a pickleball game at a rec center that's not it's not an organized sport.
That
It's not something that has a lesson or is somebody teaching pickleball.
Yep.
It's a pickleball game.
Pick up
What are the
pickleball,
rules
and
there?
that is 10 people. I mean, I don't know how you would have 10 people in your pickleball court, which I just learned was a sport recently, earlier this
It's a
year.
great sport.
I
Come
know,
on,
that's what
Jesse,
I've
you need to
heard.
play it.
I really need to play it, but I don't really want to play it right now. But so I know that often there are 4 people on the court. Those 4 people need to be from 2 households, um, unless it's a lesson. If it's a lesson put on uh, by the rec center or gym or whatever, then you could have up to 10 people, um, or I'm sorry, up to 25 people in a space. But again, and this goes back to pickleball courts. This came up with racquetball courts as well. Think about the space you're in. I mean, a racquetball court or a squash court is a very small space. You do not want 10 people in that space, mostly because those balls hurt when they hit you. But
Well, and you need to look at your capacity of that room and figure out the 25% or
exactly,
25, whichever's less of that
exactly.
particular room to
Right.
figure out your capacity on that. Um, so we have a couple organized sports leaders on this call. And, there's that, the games indoors. So I know a lot of sports, especially if they're outdoor, like a soccer or something is moving into indoor training. Can they continue to do indoor training? And what's the difference between training and the games? And then what are some of the rules they need to follow, like masking and some of those?
Perfect. Okay. So for indoor and outdoor sport, well, okay, let's start with indoor sports. Indoor sports, no games, practices. So you could have an inter squad scrimmage, but you can't have any physical contact. You have to maintain social distancing at all times, and everybody needs to be masked. You can have the 25 people because you're indoors. It's at an organized space. 25 people or 25%, whichever's fewer, but most of those gyms are quite large. Even the indoor turf field's quite large. So you could have 25 people. You can't have 2 groups of 25 separated by a curtain on a field. You have to have 25 people. They have to be socially distanced and they have to be wearing masks.
Okay.
Outdoors, sorry, I want to get, I think this is really important. Outdoors, you can have, uh, you need to, again, be limiting the number of people, and you also have to be limiting the activities. Outdoor contact sports are not allowed at for recreational use. School sports are different. They're managed under a different classification. Um, so uh, that incongruity is hard to keep in the head, but it's the way it is. If you're outside and you're playing a sport, it has to be non-contact. So I also
So let's
recommend
take
doing.
soccer, for example. It's a good season to do training.
Yep.
It's not saying no soccer.
Yep.
It's, let's do some training activity. I mean, my 11-year-old will go nuts if he can't train. But you can do training, you can do drills, you can do skills.
Mhm.
It's just limiting the ability to do the games and some of those pieces indoors and the
And
contact.
to clarify that again, soccer is a contact sport. So in any sport where you can't maintain 6 feet and still play the game, it's a contact sport.
I think there's a lot of contact sports out there, right?
Yes.
Hockey,
Yep. Yep.
football.
Absolutely.
All right. then I think something you said was very important is that a curtain doesn't count as a space divider in a room, that it has to be a solid door.
Yep. So 4 walls and a door. A lot of gyms have those dividing curtains. A lot of turf fields have those dividing curtains. They do not count. If you have one of those accordion solid walls that goes floor to ceiling and wall to wall, that does separate your room into 2 different rooms.
Uh, what's the distance of separation for outdoor groups to be considered separate groups? So if you have a group of 10, and then does that be 50 feet before you can have another group of 10, or what's the distance?
It's a great question. There is no guidance on that particularly. I would say, just as a rule of thumb, roll back to previous guidance, think about how it was set up and the way that early on fields were separated. You need to have 50 feet between fields. And that, I think that's a perfect, Corinne, you pulled that number out and I think that's perfect. If you can keep separation by 50 feet outdoors, then you can have 2 separate groups.
So let's say you have a gym and it's 27,000 square feet, but it's one room.
Yep.
The guidance
people.
says 25% or 25 guests, whatever's lower. What's your number?
25. Well, 27,000. I don't know what the fire code capacity is, so it's hard for me to
But
say.
it doesn't matter. If the fire code
Doesn't matter.
capacity, 25% of that would probably be well above 25.
So, yeah, exactly. I mean, and this goes back to that slide we had earlier that my colleague Zach put together. Err on the side of caution. Always assume the lower number. It's just safer for you.
And there are no exemptions, correct?
There are no exemptions. So at higher levels, there was talk about variances. There are no variances at Orange.
So unfortunately, and up until last week, at level Orange, all gyms were supposed to close. So that was a change that was made last week that allowed at least 25 people into those spaces. Now, does that include employees?
For gyms, does that include employees? It does not.
Yes, for gyms.
So
It does not include employees.
Does not include employees.
Okay. What's the limit on swimmers in a lap lane?
This is a good question. We're still seeking exact information on this, but the rule before was if you had a cohort like a swim team, you could have 2 people in the lane. Households could have 2 people in the lane. That's what we're moving forward with right now. You are 1 person in a lane unless you're on a swim team in a practice, or you are a household swimming together. And the one thing I noted about the swim teams that I thought was really interesting is and I don't know if this is all swim teams, but what they're doing is starting swimmers on opposite ends of the pool so that their interaction time is incredibly short. It's just that passing moment. And I think that's a really an effective way of limiting a dangerous situation because obviously swimmers don't have masks on. So there's a higher chance there of transmission.
Okay, so a couple more. We're going to keep going on some recreation questions. Yeah. Clarification on swim lesson. Can an instructor have a one-on-one swim lesson with a masked child in water with a masked instructor?
I mean, yes, that qualifies. I mean, under any guidance, you have your group of 10. I would say the one concern I have there is social distancing. If you, as the instructor, are seeing multiple individual children or adults, it doesn't matter. You are then the person who could pass that to each kid. And
so if the one-on-one instruction requires you to be within 6 feet of that person,
then no.
Then no. But if you had a parent in there with that person and you're in the pool as well and you're maintaining the 6 feet, that's a difference.
Yep, exactly.
Okay, so you have 25 people inside because your space allows it. You have a large enough space, 25 people with masks. You're doing skills and drills only, no scrimmages, no contact, especially for those contact sports, led by instructors. Can they share equipment? Can they pass the basketball back and forth? Can they rebound a basketball?
That's a good question I don't know the answer to. I can dig into that. I don't see why they couldn't. Um, the chance of surface transmission is actually quite low, but I will ask that question.
Maybe in some sports don't, lick your hands before you touch the ball, and, you limit some of those interactions. All right. A group of cyclists want to take a ride together and it's 10 people. They're distancing. Does that fall into the 2 households, 10 people, no more than 2 households rule?
So if it's either that or outdoor event, and if you can meet all of the outdoor event guidance, in other words, checking everyone's temperature and keeping a log of who was there, all of that,
Maintaining the distance between the
maintaining
people as
distance,
they are on
wearing
the
masks,
bikes.
right? Then yes. Otherwise, I do feel like it falls into the 10 people, 2 households.
Okay. So if your business has multiple areas, like an office or retail, maybe even a restaurant or a personal services within that, do you have to follow each of the individual rules?
Absolutely, yes. Each room or each area would need to follow those specific rules.
Now, how does that affect your capacity, though?
So again, your capacity is based either on, well, it's based on the room. It's either based on the number of desks in the room or the number of people who used to work in that room pre-COVID, or the fire code capacity. And so you're just looking at that.
But let's say I'm a personal service and I'm also a retailer. I can't have 25 people for the personal services and 25 people for the retail if it's one room, right?
Oh yeah, no, if it's one room, no, I'm sorry. Yes, yeah. It's by room. So in that case, you're going to want to go with the lowest possible. So, but in the case of retail versus, well, I guess personal services would have 25. Well, I think you're talking about very similar numbers regardless. The big thing
But they don't add on top of each other. That space is 25, whether it's the retail. So you need to be careful of your capacities, but as far as the orders and the sector guidance, you're going to need to follow the guidance for your office, for your retail, for your personal services, for your gym, whatever it is that you're doing in that part of that space.
Mm-hmm. Absolutely.
Okay, so we're entering holiday season, and I have a couple questions about holiday season. What are the regulations for bands and choral groups for the holiday season, holiday events?
I think under Orange, that's actually a question we're digging into, because if you look at the order, you'll note it doesn't say anything about performances. I would really discourage choral and band events. How you would socially distance those groups, and make sure that they are far enough away from their audience.
Which was 25 feet, even under yellow. It needed to be 25 feet. But even under yellow, choruses were not recommended because you have projection very close to other people.
Yep, and I would say under Orange, then you're adding this point where they're just saying you really need to socially distance, and now at that point you're at this setup where you've got too many people too close to each other.
So we have a question about Santa. What are your recommendations for an event where Santa takes the Christmas list from children?
So 2 things. One, I don't have a good answer for that. But 2, I don't know where we're going to be as we get closer to Christmas, so I don't want to answer that question. I recognize that Santa may be appearing before Thanksgiving, but I would encourage you to delay those to after Thanksgiving and see where we are after Thanksgiving. Maybe we're in a situation where more people can interact.
Okay, so your answer to the bicyclists, the 10 bicyclists going on a bicycle ride together, the individual didn't understand your answer. If the
Okay,
cyclists are
so
socially distancing properly, can you have 10 cyclists from different, from more than 2 households?
nope, unless you are meeting the outdoor events guidance, and that means taking temperatures, keeping logs of who's riding, um, and everything else under the events guidance. But it really is, um, yeah,
So, me personally, if I have, I have my in-laws and my sister-in-law over, I'm actually I'm violating the public health order myself, not talking about some other things because I have 3 households,
yep,
even if we come in under the 10.
absolutely. Yeah,
And
that's
that's a statewide order. That's a personal convening, and
mhm,
that's indoor and outdoor, correct?
yes, absolutely.
Okay. Right. So are Boulder County hospitals taking people from other counties? If so, does this factor into our metrics?
It's a good question, and it's a yes. We are taking patients. Well, the hospitals, which are amazing, are taking patients from wherever they're coming from, regardless of community, um, and it does factor into our numbers for us. For the state, they measure it differently. They are looking at your community of residents and whether you are in the hospital. So for us, it's just the number of beds that we have. We have X number of beds, and once they're full, we're over capacity. That's a problem. Um, for the state, it's how many Boulder County residents are in the hospital compared to the
And
number of beds.
just to answer one really quick question, I will send a copy of the presentation and the recording out once it's uploaded to YouTube, and it takes a little while because of the length of time. All right. So we're getting through these. Can you go again through how long you anticipate to be in level orange? And I think it's key to tell people that we have to get back to our numbers and how long we have to be at those numbers.
Absolutely. So there is no deadline. There's no like, oh, you're in this for 8 weeks or 2 weeks or 10 days. The way it works is we have to return to level 2 metrics. And I can let me go to those slides and I can. So we have to return to level 2 metrics, 75 to 175 per 100,000 for 2 weeks, no greater than 10% positivity, and decreasing or I'm sorry, declining or stabilized hospitalizations for more than 8 days. Um, we have to get there, and then we have to stay there for 2 weeks. Um,
And we haven't seen
so
the bump from Halloween yet. We haven't seen some of the moving inside. Yesterday, Boulder County alone had over 250 cases. So we are in over 360 right now. So first, just looking at the first metric, let's just look at that first metric. We have to get back below
yep,
175 as a
yep,
community, Boulder County, and then we have to stay there for two weeks before they'll look at moving us back to yellow.
and that's I mean not to well I am going to sound doom and gloom, and I'm gonna be scoldy, I guess. Halloween isn't nearly as get togethery as Thanksgiving or Christmas, and we got there. This is before our Halloween, before we see any Halloween results come in. We're already there. We're moving inside. It's going to be colder soon. We've had a couple great weeks of really warm weather, with some cold days mixed in. But those cold days are going to start happening more and more. People are going to be inside more and more. Let's think about our behaviors trying to get us to back there because the environmental conditions are pushing us more and more inside.
And when businesses reach out to me, I don't work for public health, I work for the chamber. I'm letting them know it could be a while. I mean,
Yeah,
it's at least a month,
yeah,
in my mind, just how long it took us to get back down, our numbers back down when we had just a concentrated group of 18 to 22-year-olds. to mitigate those numbers. But right now, those numbers are all age groups across all parts of the county. Getting those numbers down and then maintaining those for 2 weeks to go down. I don't think this is something that next week you're going to be able to say, guess what, we're going to be back in yellow. So just making those plans that it's going to be for a while. How likely is it we're going to go to stay at home?
Yeah, there's no way to tell how likely it is that we're going to go to stay at home. And I'm not hiding anything. I haven't heard anything like, ooh, this would be good to know. I will just say that you can see the metrics right on this slide right here. We are already at stay at home 2-week incidents. We have to demonstrate some good behavior.
So, and I know the comment is if we go back to stay at home, a lot of those businesses that are just surviving or just now getting stabilized it's going to be detrimental to them.
Absolutely.
So I think the message is do everything right, continue to follow. I know we're all going through COVID fatigue. I know, but we have to come together as a community and do this. And I know that a bunch of us are putting together messaging as, everybody in the community, whether you're at home or in a business or anywhere, need to follow these guidelines because it's impacting more than just health, it's impacting our economy. And that, the Step Up Colorado campaign that the governor's doing, we're sending those resources around to businesses and other chambers as well, because you as a business can send out a messaging like, step up, this is impacting my business. Please, telling your employees, please watch your convening on the weekend. A question came up that said, if there are 2 cases, but I know that they're not traced back to my business, but it's from something outside of business, but there's 2 cases at my business. Is that outbreak technically at my business?
No, I mean, okay, so I guess I'll put it this way. If you have 2 employees who got COVID-19 and then come, work at your business, then yes, the outbreak is technically at your business. But again, we're not going to close your business down. What we're going to do is try and figure out how to mitigate the conditions, find those 2 employees, find everyone who was in close contact with them, and allow you to stay open as best you can. This is not about shaming businesses with outbreaks. We recognize that it is not the behaviors of any particular, even individual. It's our community behaviors that are causing the spread of this. It's the fact that we actually like people that causes us to be in a situation where it is easy to spread COVID-19.
And in a stay-at-home situation, there are no exceptions.
Yep.
Businesses that are deemed non-critical must shut down.
Yep, that's absolutely 100% true.
Whether you've had a good sanitation record or no outbreaks, or you can prove your cleaning.
Mm-hmm.
That's the urgency we're talking about.
Yep, 100%.
Restaurants have to go back to 100% curbside or delivery. Salons, they'll have to shut down. Offices will have to, unless they fit into certain categories, will have to go back to, back in the office or back at home. All right. So I have a question. I think a couple more recreation questions. So if you have an outdoor spin class and it's 10 participants with a mask, does that now, if you move it back inside to a basketball court and have social distancing, you can now have 25? Is there some, can you talk a little bit about some of that, what's happening there and what some of the questions you're asking the state?
So yeah, we are absolutely, the way that the guidance is written right now, that's what it sounds like. But I will say that if you have a spin class outside that is masked and socially distanced, you can actually, according to the current orders, and it's associated with an existing brick and mortar facility, like in a patio outside that facility, you can actually go up to 25 outside.
So it's adjacent to your building, then it's in a patio, it's considered similar to the indoor. But if
Yep.
it's now a distance, a park away from your building. Now it's part of the 10-person.
Yep, that's as far as we can tell from reading through this. You could, and however, you could have a pod of 10 people and then 50 feet away have a pod of another 10 people on bikes doing their spin class. But yeah, that doesn't make a ton of sense. I recognize, but that's where we are.
So we're not currently in stay at home. We're in safer level 3 high risk, which is orange. Number high risk orange. I mean, there's 3 different ways that people are talking about it. Can you repeat again how both the orange and the red affect manufacturing?
Absolutely. So for manufacturing, if you are well, let's start with non-critical. If you're non-critical manufacturing at level 3, you go to 25% occupancy. At stay at home, if you're non-critical, you are closed. If you are critical, it does not affect your capacity, but at both levels, you need to socially distance. And I believe, I'm not going to say for certain what the rules are for critical manufacturing at stay at home. It may be that at that point you do have capacity limits, but for non-critical, the difference is smaller capacity at orange, and at red, you're closed. For critical, you remain open, and at orange, there is no impact to your capacity. At red, there may be impact to capacity. I can look that up.
And the definitions for the critical are start on page 33 or appendix A of the order, which I put into the chat. So, critical manufacturing are those things that, those defense, food processing, chemicals, computers and computer components, telecommunications, sanitary products. There's a whole list and it defines it. And if you're having a hard time, I know you can contact the COVID biz to just, COVID biz at bouldercounty.org, because we're getting back to that stage where you might have to define whether or not you're a critical business again. There's a list of critical services, critical retail. One of the people on the call did mention that it used to have bicycles in the critical retail, and I did notice that as well. Bicycle and bicycle repair is not in there anymore.
Oh.
So we might want to check on that, because that was in the original list, but I'm not sure where that went. Okay, so you probably don't know where the bicycle and bicycle repair. I'm looking for it, don't see it. We can do a question, and I know who asked this question, so I'll make sure I get back to him.
Okay, I can ask.
Hockey practice and games.
No games. 100% no games.
But hockey practice, what are the rules? It's a high contact sport. What do you need to know?
No contact, 6 feet of distancing at all times, and everybody needs to be wearing a mask. Oh, and 25 people max.
Okay, events. If you hold private events, facility rental, private events, you can have 50 people indoors with the calculator at any time, correct? But you must follow the event guidance correctly.
Yes.
Correct?
Yep, exactly. Yep, that's 100% right. And I came to that page in our presentation here. I did not include the language about if you, whatever you do, you have to follow the guidance. And the guidance is available, again, in the public health order or on the website.
And the guidance for events is pretty strict. So temperature check, there's a lot of pieces to it. So if you're looking at how to, we might have some people on the call thinking about how can I switch between this or that. And it's not a way to turn your facility into now an events facility. You need to be very clear what you're doing if you move it to an event, correct?
Yes, absolutely. And I guess the other thing is if you're trying to move between sectors, we're going to look at that and decide which sector you're in. The state's going to decide what sector you're in. You can make an argument, but you're still limited by what we perceive and how you operate. And I would also remind you, all those events, indoor events, everybody needs to be distanced further than social distancing. So they need to be 12 feet apart. And they need to
If they're not seated, they need to, and you need to have 144 square feet around each person.
Yep.
If they're not seated, if they're seated, it has a little bit different of a, and that's seated the whole time.
Yes, exactly. Yeah.
Okay, massage services and facials, are those, besides capacities at Orange, are those services affected?
Nope. Nope. Your practices are the same as they have been for a number of months now, including the ability to, if you can wear if you need to do work around someone's face and they need to remove their mask, as long as the practitioner is wearing a face shield and a face mask, that practice can continue.
Okay. And someone just wrote back that they see on page 35 that there is bicycle repair on there. I must be blind. I'll have to look at this afterwards. So
It might be in a different section.
it says automotive and bicycle repair. So we'll answer that later. What happens in 2 weeks if we're still over 350?
So that's if we're still over 350 in 2 weeks at our 2-week incidence
Actually,
rate.
before you do that, we have someone saying, will you explain that metric? What does that mean?
Yeah, sure.
Let's go back and explain what that metric means.
Best I can. And I will also say, I've got it on page 37, the bicycle repair thing. It is
There we go. Yeah, 37, automotive and bicycle repair.
It is so the 2-week incidence per 100,000 is it's a way of normalizing the number of cases across a population. So what they do is they take the number of cases you have, they break it down, they basically divide it by 100,000 to get to your number, and they look at that as an average over 2 weeks. So they look 2 weeks in the past and they add up all your cases, divide it by 14, and then it's per 100,000. I'm not exactly sure how to walk you through the math. I can do that. I'm just not prepared.
But since Boulder County has over 200 and some odd thousand, then it's then probably multiplied by over 2 point something in order to give us our incidence.
Exactly.
Okay. So let's say we get 0 cases over the next 10. That's going to bring our number down.
Yeah, I mean, so for example, so we had the CU outbreak. We had incredible numbers, nothing near what we're having now because it was in a small portion of the population. We were saying 18 to 22-year-olds are having an incidence rate of like 200 or 1,000, but it was, in just that age group. When we, 3 days after we hit 1,000, we were back down to like 20 cases per day. And that brought the incidence rate down very quickly. So we can turn this around very easily if we behave and stop gathering together.
Again, these are not Boulder County's metrics. These are statewide metrics that every county must follow. So if anybody's read the news, Larimer got moved. Larimer was close to protect our neighbors. They got moved down to yellow. Broomfield got moved to orange. Jefferson got moved to orange. So this is how Adams is already in orange. Denver's in orange. So these are the metrics that the state looks at: new cases, percent positivity, and hospitalizations. Those 3 metrics, and that's how they gauge what level on the dial that then Boulder County Public Health has to enforce. Masks. Children age, what age?
It depends. So in the state, it is 11 and older. In Louisville, I believe, it's 3 and older.
Yeah, 3 or no.
And in the county, we recommend 3 and older, but it is not part of the order.
Except for things like if you go in and to get a haircut, if it's within your sector guidance, then the age doesn't matter. That supersedes. That's a stricter order, and that supersedes the mask order.
Yep.
Okay. Can you tell you and I have been on a lot of webinars together? Right. We explained the 2-week incidents.
As best I could. Sorry, I can dig into that more with you in the math, but I think you did a good. Yeah, I think
Okay.
together we got there.
Okay. There are some questions about sick pay and mandatory sick leave and FFCRA. And how that affects businesses, especially if you're a business that is merging with one that's in another state. I know that Boulder County Public Health is putting together guidance for employers and employees around FFCRA and more information around that and I will try in the next email to send links to the Department of Labor and some other information on FFCRA and the mandatory sick leave pay. You're not able to really cover a lot of that on this call.
Yeah, I don't know the details, and I know that there's a lot of human resources details that I'm just not qualified to discuss.
Okay, so if you are a personal service or a limited health care and one of your clients becomes sick, does that count as a case for your business?
No, what we would do in that case, and again, we're not tabulating who's getting what sicknesses. What we do is we will contact you. Either one of our tracers will contact you, or one of the folks on my team will contact you and say, there was a sick patient that came in, or someone who got sick came in for an appointment. We often don't know the name of that person. We can tell you a time that they came to the store. But what we're looking for is, did anybody have close contact with that person for more than 15 minutes? If they did, those people within your business need to quarantine for 14 days. So that's what, when we contact you, we're looking for how do we protect your employees and possible spread within your business. We are not looking to call to say, Jesse came in for a haircut because it's getting out of hand up here, and I need, that is your problem now. Nope, we're there to help you make sure your space is clean, that your employees are safe. That's what we're contacting you about.
So when we were put into orange, our new case incidence was around 312, according to a letter from the state. Now we're in the stay at home. I missed the second part of a question earlier. Is there a reason that we're allowed to stay in level orange when our numbers are in the red level?
Yeah, it's a recognition, I think, of the fact that we were in level 2. We're having a statewide increase in cases, and they're recognizing that the smartest thing to do is take one step down. So, Corinne, you were mentioning counties that have moved. One county that we've been hearing a ton about, like, why is this getting to happen? Arapahoe County moved to level 2. They were in level 1. So everyone's being moved down a level, basically, to try to get a hit, like see if that increased strictness can get a handle on it. That's not to say that if next week we're suddenly at 600 cases per 100,000, the governor won't say, okay, this is now, we are past the ability to manage this. We need to go to stay at home. And I think that addresses a question that came up. Someone said, well, why are we closing down if we have had no cases? This is about a whole community being able to work together to manage the spread of a virus. Just the fact of going around and doing things and keeping the economy flowing, unfortunately, has the ability to spread this virus.
Well, and I want to tell a story. We have a lot of businesses that have basically come in every week. They're sending us their safety reports and their cleaning records, and they're showing us that they're doing everything. And then they get a call that says, one of their employees is sick. And they may have been doing everything right, but that person may have been, early on, may have been an intern at CU, or now may have been at a social gathering that caused their employee to be sick. You might have been doing everything right, but that moment, there's this, like, I can hear the fear in the voice of the companies when they call, because it's like, do I have my records? Has everybody been social distancing? Where's the exposure? And that's where that part of that community comes in, because that person may have gone to a restaurant or may have gone to a lot of different places, and they work in your facility. So we're all commingling in some way, and that's what they're trying to do, is pull that back, allow businesses to stay open in some capacity, and remind us we need to stay diligent in these efforts, because that moment that you're like, I'm not going to do temperature checks, don't wear your mask, that person walks in there and they're sick, it could spread, and then they could spread it to their families as well. So I mean, I remember, I just hear the fear in their voice. It's like, I've been doing, and I have a sick employee, and it's just, it's just one of those things that's just so hard. We're all going to be dealing with this more and more. Hopefully not for much longer. Well, we can put a date on that, but I'm not going to. Are there any discussions about citizens' appetites for stay-at-home orders or further restrictions, and whether this may cause any unrest, and if there's any plans being put in place about that?
So I am not privy to any conversations about responses to civil unrest. However, I will say that every time we talk about any movement or any new rules, the conversation really surrounds, is anybody going to listen to it? Does anybody, is this really going to have an impact? And I think that two important things are coming up in that conversation. One is, we are really thinking about, how do we make sure that the community feels like these are intelligent, thoughtful, time-limited measures that are going on. And then the other part of it is, are we making science-based decisions? One of the things, I saw a question down lower about, well, is anybody tracking deaths? We absolutely are. It's not one of the metrics we use to decide what level we go to. And certainly you could quibble with the state about what metrics they're using, but these are metrics that are used across the country. They're used across the world to try and understand the spread. And that's why they're useful for us to use in this situation. There are certainly other metrics that could be used. There's been a lot of discussion about, during the summer we had very few or very low mortality. Well, we're seeing a huge spike in mortality across the country. So, we are trying to match our restrictions with the reality on the ground. And we're also trying to understand what this means for individuals, recognizing that going back to stay at home is hard on everybody. It's hard on individuals. It's hard on businesses. It's impossible for some businesses. And we don't want to go there. The governor doesn't want to go there either, but the alternative is sickness and mortality. So that's what we're working against here. This is something that my supervisor Lane brought up many weeks ago, and I think is really important. We are not trying to punish any businesses or any people. We're trying to fight a virus. The virus does not care who you work for, what you do. We are trying to make sure that all of us are here next year. And so that's what our goal is to minimize the chance of spread.
And then I think I'm gonna close on one final question. There are some questions about iOS. If I don't have answers to if you can't upgrade your iOS, if you can get the add your phone, we're gonna need you to look at the add your phone and probably go to that. There's the questions about why one industry can do something and not another. I think we've covered those a lot in some of the other webinars, and the reality is this is the capacities. And there's been some changes, but not much over the last in the style framework. The last question is, if you can explain the percent positivity, because there's this perception that it's just because we're testing more.
Yes,
that we have more cases.
This one is a lot easier and I think helpful to understand. Um, percent positivity does not change based on the number of tests. It changes based on the number of positive tests. So if there are, and now I'm going to try and do math in my head, it's going to go interestingly. If I do 100 tests and 5 people are positive, that's 5% positivity. If I do 1,000 tests, oh boy, this is where it goes
And
sideways.
50 are
50
positive,
people,
that's a
right?
5%
Still 5%.
positivity.
It
So as
does
you
not,
increase
yeah,
tests, that percent positivity is really calculating what percent of the number of the tests are coming back positive. So that's a great indicator because it's not just that we're testing more, we're trying to keep that below 5%. Jeff Zaks always said, I want to keep that below 5%. We want to do lots of tests. We want to know how many people are out there infected, but that's really that gauge that tells us it's not just because we're doing more tests that more people are positive.
right.
Um, there's a percent, and because that's going up, we know that 1,000 tests, 12% positivity. Now that's 120 out of the 1,000 people that were tested, whereas a couple weeks ago it was 50.
Right. And I think one other thing, and I really appreciate that, Corinne, because I think this is another reason that we use the multiple metrics, because one of the things that we were really concerned about with 18 to 22-year-olds is that they would stop getting tested. That's a great way to not find out if you're sick. Unfortunately, there are other ways you find out that you're sick. You get a high fever, you have to go to the hospital, all those sorts of things. And then you get counted in the new cases. And so this is a way of catching a variety of ways of catching the same trends. And some of them are lagging, some of them, hospitalizations, you don't go to the hospital right after you get sick. It's a couple days, but it's a great way of seeing how is the virus spreading in our community. Same way with these other metrics. So keep getting tested. If you think you're sick, if you think you have an exposure, please get tested. It does not affect percent positivity to get tested. Um, that is the best way for us to figure out if you're healthy and get you the services you need if you're not healthy.
If you have symptoms, get tested.
Yes. If you don't
If
have
you've been
symptoms and you haven't been exposed, oh, sorry, go ahead, Corinne.
Well,
Sorry.
but if you've been exposed and you don't have symptoms, you have to quarantine for 14 days.
Yes.
And testing the first day is not going to get you out of that quarantine because it could take up to the 14 days for you to test positive.
Yeah, absolutely true. And I would say, there are definitely, earlier in the year we had terrible shortages of tests. Those have mostly been alleviated, but don't just go get tested for fun. It doesn't. It clogs up the system and it doesn't tell you anything. If you think you were exposed or you're not feeling well, get a test. If you know you were exposed, if your phone app says, "Oh, you were exposed," quarantine if you can. Check with public health before you make any rash decisions like not showing up to work. But you know, you want to avail yourself of as much information as possible before making decisions.
But let's say my sister, I don't have a sister, but my sister comes back tomorrow and says, I saw you a bunch this weekend. I just tested positive. I have to quarantine for 14 days because I was within 50, wasn't wearing a mask. I was within, 6 feet of that person. I'm not showing symptoms. It takes at least, if I wanted to get a test, I needed to wait at least 7 days because it takes a little while for the virus to show up in your system. And it could take up to 14 days.
Absolutely. Yeah, that's a really good point.
Okay, so if you have been exposed before and start feeling ill again, should you be tested?
Yes, there is no evidence. Well, I shouldn't say there's no evidence. Lots of viruses, once you've got your antibodies, you can't be infected again. But there's evidence that people can be reinfected with the coronavirus just like, say, chickenpox. If you don't have a bad case of chickenpox, you can get chickenpox again.
Well, and even in this case, this person has symptoms,
Right. Which,
so get
yeah,
tested.
yep,
Okay.
absolutely.
All right, I'm going to, that was a 95-minute webinar, Jesse.
Oh
Thank you
boy.
for doing this. We knew on Wednesday when the order came down that we would need to do this. There's a lot of questions out there. So
Yep.
we're gonna have a recording of this. We'll have the slides. I will send it out as soon as I can. I want to thank everybody for joining us, for asking your questions. We know this is difficult. And I've been on a lot of webinars with Jesse, and the number of questions and interactions with businesses that he's had, I've heard in other counties, we have a lot more interaction with our businesses, and we're hoping to keep it that way. We want to get your questions answered. So even between these webinars, please, 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 ask them. And we'll try to, and you can email me, you can email that COVID biz at Boulder County.
Yeah.
And he's going to go
Corinne,
to
I
that
just want
last
to say
page.
thank you. You're the reason we're doing these, so I really appreciate it because it's been super helpful for us.
And I will continue communicating with businesses as we know more information. And then, attend these. We have them every Wednesday at 3:00. We understand that next Wednesday is Veterans Day.
Oh yeah.
Yeah, but
we can talk about maybe moving it. I don't know. Yeah.
Or we could talk about having a difference. Yeah. So we've already put out. So we'll talk about what that means. But thank you for everybody, and we'll see you next week. Stay safe, stay healthy. Let's try to get this under control.
Yes. Thank you, everybody. Thanks, Corinne.
Thank you.